Now, we were talking earlier with the Health Secretary about coronavirus, and joining us now to give his take is the Chair of the British Medical Association, Dr. Chaand Nagpaul. Thank you so much for being with us. It feels to me as if people are trying to work out how concerned they should be about coronavirus. How worried should we be?
Well, clearly this is an issue of both national and international concern. So we do need to be concerned, we need to be vigilant, but equally proportionate in our concern and not panic or be alarmist.
We've seen some of the government's ideas for a battle plan, if you like, against coronavirus. We spoke to the Health Secretary, Matt Hancock, earlier on the programme. He seemed to be saying, look, the best thing you can do at the minute is wash your hands, sneeze into your elbow, etc. Is that enough? Or should we actually be looking at more precautions, such as the ones that other countries are taking, banning flights, for example, from people who are recently coming from China, banning meetings of over 5,000 people indoors? Are we doing enough?
So each nation has to take its own measures based upon circumstances. In the UK, we've tested over 10,000 patients or individuals, and we have 23 confirmed cases. So at the moment, and of course this changes on an hour-to-hour, day-by-day basis, at the moment, containment seems to be the correct procedure, and therefore simple public health measures like washing your hands for 20 seconds, making sure that you cover your nose, bin a tissue if you sneeze or cough, are proven ways of containing spread of the virus.
Is there anything else that people should be doing to keep themselves safe? I mean, I was struck by the director of the World Health Organization saying if you're over 60, perhaps think about avoiding crowded places or places where you could meet people who are sick. I mean, is that the kind of self-preservation, if you like, that some people should be thinking about?
Well, we know that the virus is relatively mild in healthy adults and is much more potent and causes more illness in those who are older, those with pre-existing medical conditions. And that's the advice we give, in fact, during the winter season anyway. We're not at that point at the moment, but of course, again, that advice, which is based around public health experts, may change on a day-to-day basis, but we're not at that point at the moment.
How about travelling? I mean, if you were someone over 60, would you be thinking about going to Italy, for example? Again,
we have to be proportionate. We have very up-to-date advice on foreign travel, so anyone considering travelling abroad should take that advice. Again, it's about being proportionate and also making sure that you seek the right advice.
It feels as if caution and proportion, not panicking, is the message coming across from yourself and also from the government. Given how quickly the virus seems to have gripped certain countries after entering them, is there not a worry that this is a little bit too slow, that we should actually be doing things more quickly before we get to that stage?
So absolutely, whilst we are at the moment focusing on containment, at this very moment, and for the last few days, if not weeks, I would be hoping, and I believe, there are plans that should be made regarding an outbreak that becomes more prevalent.
And what kind of things would that be?
Well, obviously, we need to have emergency planning for right up to worst-case scenarios. That has to be planned for now, in case that needs to be invoked. That's not being alarmist, that's just being sensible, and that is what I believe the government should be doing and are doing.
What is that, then?
Well, if we were to have an epidemic in this country, we'd need to move beyond the containment phase to actually mitigating or managing that crisis. That may involve, for example, having to reduce or cancel planned care in hospitals for non-emergency operations, so that you prioritise the availability of care for critically ill patients. So that's a sort of thing that may need to happen, but I don't want to create alarm at this stage. But those discussions, that planning, will need to be taking place now, and I believe has been doing so.
I'm interested to know your thoughts on how prepared the health service is for this kind of event. A couple of weeks ago, you said this about the NHS, not, of course, in relation to coronavirus. Stories of patient deaths on corridors, rammed emergency departments and cancellations of patients' procedures as a daily occurrence are becoming the new norm. I mean, could our health service cope if coronavirus does become more serious?
Yeah. So I think this is the difficulty. Whilst we are rightly preparing for an outbreak of coronavirus and trying to contain the virus, before this current episode, we had a health service in December that was suffering record waits for patients in emergency departments, record numbers of patients on waiting lists. And we heard from the Royal College of Nursing that 75% of nurses are now providing corridor care. So we have a health service already under severe pressure and strain.
Are there enough beds, frankly?
Well, I think what would need to happen is that the nature of the beds would need to change. We'd probably have to convert parts of hospitals and wards from routine services to emergency services or critical care services.
So things would have to be cancelled, effectively?
Look, if there is going to be an outbreak or an epidemic in this country on the background of a health service that was struggling to cope, as the BMA have said, as I have warned, as we have the patients in the nation experience, clearly there are going to be consequences and the right decisions will need to be made. And in an outbreak, in an epidemic, those who are seriously ill will need to be prioritised. And those plans would be, I believe, be happening now because we do need to plan for the future.
I mean, John McDonnell was saying earlier that austerity on the NHS could potentially hit how the government can respond to this kind of thing. Is that right? Matt Hancock said it was not right.
Look, we've been saying for a long time, and not just us, but all health experts, that we haven't an NHS that has the sufficient numbers of beds and staff compared to many other European countries. And we know, for example, when you look at critical care beds, Germany has 4 times as many as we have. So we clearly have a background of not the sort of capacity that the health service needs. But having said that, in an emergency situation, we would have to adapt and make provision for that emergency that faces us.
Just finally, there's been lots of talk about a vaccine. How far away are we from getting a coronavirus vaccine?
So at the moment, a vaccine is being researched. The trouble is that it will take months for that vaccine to actually be available, and that would be not in time for the current situation we face. So the efforts that we're making now around identification, isolation, containment is absolutely right. And there are other very practical issues that we need to take forward, making sure that no one who may be suspected of carrying the infection goes into a GP surgery. You know, we've had cases where a patient may have attended for example, to get a fit note for work, and the practice has had to close down for the day. And those sorts of issues can make a big difference. So it's really important that the public understand the need to isolate, the need to seek advice from NHS 111. We may need to move to more remote working, for example. Many GP surgeries may be offering more telephone appointments, follow-up for patients on the phone. We may need to move to more social distancing for more patients or more workers working from home to try and contain spread of the virus.
OK, thank you so much for coming on the programme and explaining the latest. Much appreciated.
Thank you.